everyone, to today's statewide call. So for those of you who don't know me, I'm Michelle Shepard. I am a pediatrician and a faculty member on the Perinatal Equality Collaborative Vermont, improving care of newborns with substance exposure, or ICONS. And today, our statewide call is going to focus on a very important topic that we don't talk about enough here, human trafficking. And I have the pleasure of introducing our speaker today. And first, is there any housekeeping that I need to make sure we cover? This meeting is being recorded and will be available on our website afterwards. We often also provide slides via PDF for those of you who would like that afterwards. And we're always open to suggestions for other topics that you would like to hear about. We do appreciate everybody's feedback and evaluations. It really does help us come up with our next topics. So, without any further delay, I would like to introduce Katie Newell, and I'm just going to read your brief bio if that's okay. So, Katie Newell has served as the Human Trafficking Case Manager Coordinator for Vermont since 2018, providing low barrier services to individuals who have experienced exploitation or at risk for exploitation. In addition to providing direct service and overseeing the Human Trafficking Case Manager program, Katie is also the co-chair for the Vermont Human Trafficking Training and Outreach Committee, who provides training across Vermont for law enforcement service providers and community members. And we are so fortunate to have you here today to educate us on this topic. So I'm going to mute and turn it over.
Thank you so much. And I am so happy to be here. I have so much information to cover. And so I want to share that since this is going to be a 1-hour training and we're not going to be able to cover all of the details, if there's something in here that you would like more information on, I would love to continue the conversation. Because in 1 hour, we're not able to unpack too much. So thank you so much for the introduction, and I am happy to be here. So let's get into it. So we're going to start with this quote because I think that that's pretty powerful from a survivor. We are failing because we have not identified human trafficking as the public health issue it is. You see, trafficking is not a short-term affliction. It affects a survivor's whole life, families, and even entire communities. And in our time together for the next hour, I really want us to have in the back of our minds that understanding that some individuals may have been exploited by people that they trust, and they might not be recognizing that their experience is exploitative. So I want to really talk about that. Human trafficking is our language. And if we're talking with individuals that we're serving and we're like, I think you're being human trafficked, we're likely going to be met with, you watch too much Law and Order. And so it's just finding that way to meet that individual where they're at and be able to explain and discuss their experiences in a way that works for them. You can go to the next slide, please, Angela. So it's really important to take care of yourself. I don't need to tell you this, but I feel like I need to tell everybody this because we always push things aside, right? I can handle that. I know you all are working in various capacities where you're likely you hear often that it's really important to take care of yourself, but please do so, however that looks like for you today. Thank you. Next slide. I love this quote by a survivor, and I think it really paints the picture of trafficking. If you were to throw a frog in a pot of boiling water, it would jump out immediately. However, if you were to put a frog in a pot of regular water and put it on the stove, allowing it to heat gradually, the frog would cook to death. That is human trafficking. Women, young men, and children are sitting in what appears to be regular water to them. However, it is heating up all around them. If we do not start helping them identify when the water is getting hot, they will cook to death. And so it's crucial that we're bringing awareness and prevention to our culture so that our vulnerable people can jump out before there is further damage. And we can be a part of that jumping out process. Next slide. And so, what is trafficking, right? Trafficking is a crime that involves the exploitation of a person for the purpose of forced labor or commercial sex through the use of force or fraud or coercion. Now, anybody under the age of 18, there does not need to be an element of force or fraud or coercion. However, we would want to show or need to show that that young person had been recruited, harbored, transported, enticed, or provided for the purpose of a commercial sex act. And that's not important for you to know. But what is important for you to know is that the definitions of trafficking are really influencing what the prevention and responses are to trafficking. You see, our statute for trafficking, if we're going to consider, our statute came in at 2011. That was not much, that was not very long ago, right? And so, due to the varying definitions of trafficking and what that's looking like, and we'll touch on this in this time together, that developing universal tools for identification of trafficking persons is hindered by this diverse and inconsistent definitions, right? Because we have commercial sexual exploitation, and then we have something that's very nuanced called forced criminal activity that then is covered under labor trafficking, right? And so we are having a hard time identifying it because that is shifting and changing our own perceptions of how we're reading and understanding the definition. Go to the next slide, please. This is called the action means purpose model. As a visual person, I like this. And this actually mirrors our federal definition. So how did that person get into the situation? They were recruited, harbored, enticed, transported, provided, or maintained for the purpose of involuntary servitude, debt bondage, peonage, or the sex trade. And they were kept in the situation through those means of force or fraud or coercion. And I say or because it can be a combination of, or it could be one or the other. Now, again, just to show that anybody under the age of 18, there does not need to be an element of force or fraud or coercion. However, that young person, right, would be recruited, harbored, enticed, transported, provided, or maintained for the purpose of a commercial sex act. I do not have a section in here specific to minors. I wanted to really have as much engagement as we can, but we can come back and do a session just on minors if that is something. But so for anybody under the age of 18, for commercial sex trafficking, the way that I explain it is anything of value exchanged for a commercial sex act can be under the umbrella of trafficking. A blowjob for a vape, that can be under the umbrella, right? And that whatever is of value is what is of value to that young person. We can go to the next slide. So what is force, fraud, and coercion, right? That is the means for which the individual is trafficked, right? And we can understand force, right? We want to talk about that, but we also want to really talk about the impact or the threats or perceived threats of physical, sexual, or verbal abuse, right? That or using something as a method of control, right? In facilitated drug use is something that I often look at, especially when I'm working with an individual and they express to me that they only smoke and only smoke and snort drugs. And then time goes on and I'm learning that they have explored working or having using needles. And oftentimes just coming from a place of curiosity with that, I learned that that was mostly facilitated and oftentimes it's to show like a different way of feeling high. We're also wanting, the isolation portion, right? Not allowing individuals to go anywhere alone, taking away an ID or using the system involvement against that individual. In Vermont, what I'm seeing a lot of, in addition to the threats of force, physical assault, is these false promises of love, attention, affection. I am going to take care of you. The psychological coercion is so, so significant because they're the individuals who are exploiting other people. They are so skilled at honing in on a vulnerability that a person has and becoming anything and anybody that that person needs. So those promises of love, marriage, education, promises of that better life. And then coercion, right? A lot of the individuals that are experiencing exploitation are vulnerable. They have so many intersecting social issues, right? And so that is those threats of arrest. I'll call your probation officer. I'm going to call DCF. going to call your DCF worker on you. I will call, you are the person that has the drugs or you're committing crime. I have done nothing. And so that's really ingrained in an individual. And as we'll learn as we spend time together, that this doesn't happen quickly. It is a gradual expansion of these understanding a distorted version of what an individual's needs are. Next slide, please. So no surprise, right? Sex trafficking survivors face unique challenges in accessing healthcare, including fragile trust in healthcare professionals, stigma, and fear of judgment, right? They're also facing barriers to care to include substance use disorder, financial vulnerabilities, and are at high risk for chronic and acute health issues. There is limited research on the topic, and the limited research in trafficking in general, right? Right now, there's a lot coming out, and so I've been reading like a machine. But the limited research that we have right now indicates that trafficking survivors do not think healthcare providers understand their experiences and fear harmful outcomes because of disclosing their victimization. And I have had experiences with clients that I have served in their fear of going to an emergency room or going to receive care because they have a warrant. And they think that the hospital is going to be calling the police and having to have them understand that that may not be the case. But what I know to be true is that they're being taught that by somebody, right? Through that coercion. If you ask for help, this is what will happen. I am the only person that you can trust. We can go to the next slide, please. And when we're talking about coercion, right, we're talking about how hard it is to see and understand when we do not know an individual's vulnerabilities. And what do we need in order to learn about somebody's vulnerabilities? We need something that not many of us have, and that's time. And that is why it is so, so, so important for us to be working as a team when we are supporting an individual who has experienced exploitation, because we need to find the people that have the time to learn the vulnerabilities to then help them navigate this very complicated system that we're in, right? So taking that trauma-informed harm reduction approach prioritizes the understanding and lived experience of that person that has experienced exploitation. And it is so important to also consider when we're working with somebody who has experienced any trauma, but what if this wasn't the worst experience that they've had? What if trafficking is not the worst experience that this person has had, right? And so taking our reactions out of it, right? And it's really important when we are with an individual who has experienced trafficking to understand that reasonable person of the same background and in the same circumstance. We are not comparing the choices and options that we have to what the choices and options of this individual that we're serving has, right? And so those vulnerabilities are so relevant in determining whether coercion could plausibly have compelled the victim. Next slide, please. So considering intersections also involves locating people among more than one axis of power, the experience of multiple identities of race, sex, class, sexual nationality, religion, and more. So the risk factors, right? It includes low income or lack of employment, but I've also seen people that have come from affluent families, that come from what we would consider the perfect family. They have the wonderful house, they have all the means, they have what they need, right? We want to be looking at the limited English proficiency. Trafficking is rooted in interconnected systems of oppression and inequality that create those vulnerabilities to exploitation. And so they're targeted based on these vulnerabilities. And that can be so great. So next slide, please. In this slide, we are going to be looking at some of those intersecting social issues, right? Those push-pull factors, right? Similar risk factors, right? Experiencing poverty, not having food or clothing, at least sometime during childhood, any experience with sexual or emotional abuse, anybody that being run away, being bullied, right? Bullying can escalate into trafficking when you're being trafficked. They may identify what's happening to them as being bullied instead of being trafficked, right? And so, with the intersecting social issues, those barriers, right, including system involvement, gang involvement, I know not many people want to talk about or acknowledge that we have gangs in Vermont, but they're here. What is the relationship with the trafficker? And a trafficker is, as I said, very skilled at becoming everything that that person needs and wants from somebody. And so oftentimes that may look like a boyfriend or girlfriend or provider or partner, right? It could also be a family member, right? Remember talking about people who have been exploited by people they trust, so they're not able to recognize their own experiences. Next slide, please. Now, this is a mainstream, right, public approach to equity, right? So upstream, that's where we're going to be wanting to, in your work, right, focusing on addressing the root causes and systemic factors that increase the vulnerability of trafficking, which includes addressing the social parts like health, like poverty, lack of access to education. And then midstream, right? These are where the interventions are targeting organizations and institutions to create those safer environments. So in Vermont, I think we're needing to build our stream, we're needing to build our teams, right? This comes in with training healthcare workers and educators, implementing screening tools, having those conversations, starting to forge those partnerships between healthcare institutions and anti-trafficking institutions, promoting ethical business practices, and then downstream, right? That's where the providing direct services. And so take a moment and consider where in your role are you on this, right? Are you upstream? Are you working on those policies and procedures? Are you midstream kind of overseeing those organizations in a place to be building those relationships and promoting those like multidisciplinary teams or being participating in a multidisciplinary team? And then, or are you downstream? Is your focus providing direct services and supporting individuals, right? We all need to be on the stream, and we can, I believe that we'll get there. And when I sign this out, I can send out kind of my little write-up of the stream so that you can understand it. My brain works in photos and pictures. So next slide, please. Next slide, please. Okay. Trafficking versus smuggling. Hot topic. You don't need to cross state lines in order to meet the trafficking threshold. That's first and foremost. But it is important that we're talking and addressing that trafficking and smuggling are two very different things. Smuggling involves the transportation of an individual, and trafficking is the exploitation of the individual. So a trafficked person is seen as a victim by law, and a smuggled person as seen as a criminal by law. Now, can we see where situations where somebody who has been smuggled or agreed to be smuggled to another place and they worked with a coyote or whoever they worked with, they had an agreed upon price. Once that individual got to where they were going, things may shift, right? The work may not be what promised. The debt may be different. And then we can see somehow coercion may play because now that person may know family dynamics or where your family's from. They may know more about you, right? They've spent time learning about that individual's vulnerabilities. So it is important to distinguish that they are two separate and that they can also intertwine. Next slide, please. So this is a, definition for labor trafficking that I really appreciate because I think that this, for me, brings it home for when I am trying to express how challenging it is, especially in our state. So labor trafficking is a crime that involves compelling or coercing a person to provide labor or services. Labor traffickers often prey on those with vulnerable life circumstances and economic hardships. Labor trafficking victims can be found in legal and illegal labor industries, as well as hidden behind closed doors and in plain view. But I want to highlight, labor traffickers prey on those with vulnerable life circumstances and economic hardships. That can be so many people, right? That could be really anybody. I have had experiences where traffickers are offering to pay a mortgage to run their work and business out of somebody's house. And if you are in a spot in your life where you cannot see any other option, I can clearly understand that that might be something to then not lose my housing, to then maybe not lose what I've worked hard for. And so it's really important that we're recognizing that this is not something that is that we should be othering, because this is something that's happening in our community with people that we know. Okay, next slide, please. And so forced criminality, that is a form of labor trafficking. It's where that victim is exploited through forced engagement in illegal activities such as street crime or drug trafficking. So what I'm seeing a lot of is drug offenses. Also illegally purchasing firearms for somebody that can legally have a firearm. It's called straw purchasing of a firearm. Theft, credit card fraud. Also, car retail theft, and then stealing vehicles, right? And so when we're talking about forced criminal activity, we're wondering, what would happen if you were to say no, right? And oftentimes it would be, we'll go back to that, the means, right? Physical assault or coercion, something bad would happen. Next slide, please. So this is a quote from a survivor, and that her trafficker created a scheme to ensure the legal system saw her not as a victim, but treated her as a criminal for the crimes he forced her to commit. And so let's think about this with an individual's initial vulnerabilities, right? And then that trafficker is exploiting the victim's fear of distrust of law enforcement, but we're going to expand that into the system, right? And then the arrest or that system let down, right? It reinforces that victim's fear and distrust of law enforcement, where then the victim becomes more reluctant to come forward. And then the trafficker retains control by saying, see, nobody else would have helped you. I am the only one that's there for you. Because the trafficker is always going to be there to provide what we cannot. And as you all know, through our resources in the state, we can't always offer much. There's not much that we can offer sometimes. Next slide, please. Next slide, please. I've been learning Canva, so these are where my fancy photos are from. So as we know and understand, substances are playing a role in trafficking, right? They may be used to further exasperate their vulnerability. There also can be used as a reward or punishment in order to stay in control. The drug dependency can create a drug debt because those checks and balances may not always add up. It will incapacitate an individual. I mean, if we are considering being forced to engage in multiple sex acts in a day, I think that having an anesthetic might be helpful in needing to numb not only your emotional self, but also your physical self. And then it can also guarantee that that individual will become dependent. Next slide, please. And so the also may be used as a way for coping. And I am a big believer that we cannot remove all of somebody's coping all of an individual's coping mechanisms. We need to really be taking that harm reduction approach, because if we are stripping them down to be abstinence based, how are they then? We're asking them to be completely raw and vulnerable and to work through things that maybe we are not even able to work through in our own adult lives, right? So coping can look like avoidance and being under the influence to process through those traumatic incidents. Cope with the overwhelming feelings of what is going on for them, and also really work to help with those long-term feelings of shame and guilt and feeling responsible that they are causing, right? In their idea, they're causing the problems that they have, that they're in. Next slide, please. And so why is the significance of the stigma of substance use disorder, right? That stigma makes it so much more difficult for individuals with substance use disorder to receive help, right? So in addition to when we're working with individuals who've experienced exploitation, research shows that identifying a singular trusted person in a clinic or with knowledge of sex trafficking around substance abuse has been critical in developing that more of a positive interaction. Um, I'll be honest with you, really what we're wanting to do is to build trust and demonstrate with the individuals that we're serving that we are confidential because that is earned, right? We should not be just told that we're safe. We need to show that. Working with them in a medical exam that is least invasive and as trauma informed as possible. So it's so, so, so important to be communicating with the individuals throughout a procedure on what is happening next. Allow them to know what to expect or what is coming because oftentimes that has been taken away from them, right? We know for fact that healthcare providers may be less likely to believe a patient, or this is how the individuals feel, their self-report if there is substance use disorder present. And so that's just an added layer to the onion. And that we also know that individuals are less likely, sorry, likely, I shouldn't touch my computer right now, less likely to return for medical care or mental health treatment after a stigmatizing or negative experience with a provider. And I had a quote on my research paper, but I lost it. And so I'll come back. Give me 1 second to take a look at this quickly. I will, it will come to me. Next slide, please. You can go to the next slide too. Who commits acts of trafficking? It is anybody who profits. As I've discussed, a trafficker is looking for a vulnerable individual who has low self-esteem and minimal social supports. They're willing to invest a great deal of time and effort into the victim to break down any natural resistance and suspicion, right? And so it can really be a person, anybody that is in an individual's life. The difference between that we can keep in mind, the one distinct difference between domestic violence and trafficking is economic gain. So the trafficker is gaining it. This is a business, like from my perspective, it's a business transaction. From an individual perspective, it is a relationship and probably the best relationship that they've ever had. Next slide, please. We've all known and understood Maslow's hierarchy of needs, and I have found this, and I think it's so telling, and I love to use this now. So my job, this is a direct quote from a trafficker. My job is to make sure she has what she needs. Personal hygiene, get her nails done, take her to buy an outfit, take her out to eat, make her feel wanted, but I keep the money, right? And so when we are meeting with an individual during periods of their exploitation, because it's really important to note that just like healing is not linear, a trafficking experience is not linear. People may be coming in and out of the life and having multiple traffickers. There was a young woman that I worked with for 6 months. In those 6 months, she was trafficked by 3 different groups of people. Okay. And so the trafficker, they're luring the victims in by providing basic survival skills, but they're also giving a distorted version of higher needs in order to manipulate victims. And it is known that for many victims, the life or being in this type of dynamic is the first experience, their first experience of having a family or having a belonging. I worked with a young woman, and she was in, it was in 2018 when the women's facility was in Virgins for Valley Vista, and there was a man that drove from Burlington every single weekend to see her. He even went on the weekend that her parents were bringing her son, knowing that he could only stay for 15 minutes. He remembered that she loved the Olive Garden, and she had told him that 3 months prior, she reported. And he also brought her a birthday cake. So he was providing her with something that she needed in her inner cup, right? And individuals are also being taught that we as providers, like we are only filling outside cup, right? And I can also see that as I'm navigating the system with the individuals that I'm serving is when we're building teams that it is that needing to stop going through a checklist and really trying to make a connection. with the individuals. And that is what allows all of us to work together to meet these needs, right? We understand that when I'm going to use an example for when I'm working with somebody and I'm going to say like they may be up in that like love and belonging section, excuse me, through Maslow's, and I'm down having to show them that I can help you find ways to survive, but you've got to do it on your own. And I'm going to be here to support you. I'm not going to do it for you. Right. And so that is where we're up against. I kind of see in my mind, because I've said I'm a visual person, kind of seeing somebody climbing up this Maslow's hierarchy of needs, right? And where we are versus where the trafficker is by the time that we are meeting up or interfacing with an individual who has experienced exploitation. Next slide, please. And so how are they grooming and controlling victims, right? They are targeting, identifying people with noticeable vulnerabilities and needs. This may be online or it may be in person. When it is online, you can outreach multiple people. It also may be through the group, through the crew, right? I worked with a young woman once and she said, Katie, I do not know how to make friends because my role was to go out and find and meet people that met this criteria for us to invite into our family, right? And so they are no, so I think when I think about what, they're looking for, it's the person that might be online a lot. Want. I don't have anything to wear. I'm having a tough time. I'm seeking something, right? And so a trafficker is going to be gaining trust. They're going to invest time. They are going to break down natural resistance to suspicion. And they're gaining that trust and collecting information that will be then used to manipulate the victim. And that is in a way that happens in a way that's gradual, that we're not easily able to see. And through that gaining trust, right, is also the meeting needs. And so they're building this person up to be who they want and need them to be. And that may feel good, right? I'm getting new clothing. Getting a sense of having a new sense of self, right? I'm feeling a connection that I've never felt before. But in fulfilling those needs, it allows the trafficker to gain power. And then that power becomes that power that's able to provide, but you're also able to take that power away. And so that person is being manipulated and saying, well, I can give you all this, but I can also take it away as fast as you've had it. And then you will have nothing. And then you will not be, who I want you to be or need you to be. Next slide, please. And so then they're controlling their victims, right? So as this is happening, as the gaining trust and meeting needs, and I think that we would say that's probably like the honeymoon phase of a relationship, right? There's also the distancing of victims from anyone who may weaken their influence. And that's all of us, right? That's you and your role. That's me and my role. And so where the exploitation comes in, there's like that expansion of boundaries. And the expansion of boundaries, it may be gradual or it may be otherwise. It may be sexual, oh, excuse me, it may be gradual, but it also may be sexual, or it may be, in a sense, testing loyalty. What can I get you to do for me? Have I done kind of testing their skills? Have I done a good enough job? So that may look like retail theft, taking trips out of state, purchasing or, moving drugs. It can look like anything. Oftentimes that's quick money. In Vermont, we have a handful, I've had a handful of experiences in consulting where I've learned that people are going to college parties or high school parties or local bars and offering ways to make quick money, which is, through selling or moving drugs. And then it may shift to where somebody thinks that they have control and that they have some power, and then realizing that they actually don't have as much power and control that they have. And then starts to make the exiting, like that talk of exiting, right? That pre-contemplative stage of leaving challenging, because now we're telling them through psychoeducation, like these are things that were done to you and for you to not realize what's happening. In that maintaining control, right? That gaining full control over the victim, and then, right, manipulating them into cooperating in their own exploitation. And this makes it so complex, especially when somebody is not ready to hear what their experience has been. And so we need to be treating people with respect and allowing them to come to terms, allowing them to be in a place to hear what the experience has been, and be mindful that we are not offering that psychoeducation too soon, so that we have the possibility of kind of losing um, any rapport that we've built with that person. Go to the next slide, please. This will tie it together, right? So traumatic bonding, right? We all know about trauma bonding. The goal of that perpetrator is to instill in his victim not only fear of death, but also gratitude for being allowed to live, right? And thinking about that, thinking about now we're going to be uh, offering options to a person that we may not be able to follow through on. There was a young woman who was identified by law enforcement a couple years ago, and law enforcement said, we can get you a hotel, we can get you a phone, we'll get you food. And she said, no, no, thank you. I'm going to go back. And the officer was like, I don't know why she said that to me. I mean, I was like, going to get her out. And the response, and if we were all in person, you would all be having to talk to me right now. But the response was, you can give me this for one night. There, I know what to expect from them. There's consistency, right? And so that is something that we have to know and understand. Next slide. Okay. I'm doing pretty good on time, I think. So does anybody have any, let's wait till the end because then we can get lost on questions, right? Next slide, please. It will never cease to amaze me how hard it is to try and get people out of this life. This is a quote. Well, it's actually a text that a UVM nurse sent to me recently. And she worked side by side with me with trying to support a young woman, probably for about 6 months. And this is probably the most validating thing that anybody has ever told me or shared with me in the time that I've been working, because it is so challenging. It is not on our timeline, it is on their timeline. And so we need to constantly be checking our own selves, checking our want and desire for the individual, and check that against what their needs are and what their capacity is for making decisions for themselves. Next slide, please. And so understanding the impact, right? This is people respond to traumatic stress in so many different ways. And so understanding that that repeated exposure affects their brain and nervous system, and it increases their risk of engagement in healthy behaviors, and really causes, it is impactful, kind of going back to that slide that we talked about earlier, about how it affects an individual's entire life. And so let's not get hung up on how long they were in the trafficking experience. Let's understand what the impact of that experience was for that individual. Next slide. And when you are working with somebody and you're wanting, it's important to recognize that they are likely involved in multiple different systems. And so you building a relationship with them is going to be challenging in like a problem in one area, right? One of these areas can cause a chain reaction. So losing a job may impact where somebody can live. It may impact their access to healthcare because they've had that one person that they trust. Let's talk about our using 211 for an example. I have had so many experiences where a person has called for economic service housing, and it is somebody that is in Chittenden County. They have a team here, they have providers that they trust, but the bed available for them is in Brattleboro. And so I'm sorry, that's where you have to go. So when I'm hearing that, I'm hearing that I have a trusting relationship with my team. We are not valuing that individual's experience, right? We have teams, we have our trusted providers that we have. And so recognizing when we are working with somebody that they're likely involved in the criminal justice system, social services, healthcare, employment, housing, educational system, and all of this has a ripple effect. I guess also consider the ripple effect that it would have on your own life if one of your chains were to break, right? And so for me, it is so important that we are giving the same dignity and respect and grace that we are to our professional peers as we are to the individuals that we're serving, and coming from a place of understanding that it is really hard for them to be vulnerable. And we are asking them to completely take down their armor and do something that we don't know if we'll be able to follow through on. Next slide, please. I didn't say it was going to be the most uplifting hour of your life, but we're here and we're doing it. So I'm going to send out this study to you after once I PDF this, and then I'll send out a couple articles that I think will be helpful, and then some links to some healthcare where you can start your own psychoeducation reading. So this is from a study from October of 24, understanding the retrospective and current healthcare needs and service experiences of adult survivors of minor sex trafficking, but it applies. So for the age 1 to 15, this person this is talking about what their healthcare experience was before trafficking, during trafficking, and after trafficking, right? So a lot of what they've said is up until you were 15, did you see the same pediatrician, your pediatrician through 15? And that person said yes. Did you go to the dentist regularly? Yes. Okay, and did you receive vaccinations? Yes, right? So that this person felt like most of her experiences were neutral. She had a positive experience when her parents divorced in fifth grade, and her dad modeled good health care, and then had another neutral experience with her appendicitis and broken elbow, went in for care, no further inquiries. So then during trafficking, she was placed in an adult section of a state mental health hospital. Mental hospital workers did not question her new relationship with an older patient at the facility. In foster care, her only solution was birth control and pills. Therapist solution was medication disregarding past drug experiences. I was about 15. I was put in the state's mental health hospital. I guess the youth one was full. So I got put in with the adults. I quickly established a relationship with somebody much older in that facility. That was, I guess, my first experience with trafficking, which I wouldn't have even known then what that was. I think it's important to highlight that in Vermont, we have 2 places for individuals to go to inpatient for substance use disorder. There is nowhere in the state for anybody under the age of 18 to receive support for substance use disorder. That's terrible. After trafficking, right, what the experience was, OBGYN restricting what tests could be done during the pregnancy. Doctors only have 15 minutes with patients. Denial for nutritional guidance. I mean, recently I was struggling with my eating, so I ended up seeing a male doctor because there was no other option. I told him I wanted to learn to eat healthier, and he said, "Why can't there's no magic pill for what you're asking?" That hurt, you know? Unfortunately, I have to switch doctors often because I pick up on vibes that remind me of the past traumatic experiences. When I feel like I'm being rushed or processed out, I'll say, maybe we should do this another time because you seem like you're being in a rush. So just as we are assessing individuals, they are assessing us. And it is so, so, so important that we are meeting with them in as much of a calm nervous system as we can and supporting them in a way that feels right for them and building a team around them. Next slide, please. And so this is another example. I was so young that they couldn't pinpoint who was touching me and all the things. All they got out of me was the father figure. I was under the age probably of 3, turning 4. I was right there in that window, but doctors said, go ahead, right? Having neutral experiences, but when she was 5, there was no other care unless a fever occurred. And domestic abuse from age 5 to 11 was in and out of foster care. And then during trafficking, was not treated for trafficking injuries due to dismissive medical staff. Third-party adults did not look beyond the surface level indicators of trouble. And I think that that's fair because I think that sometimes it's hard to see and we have to feel the feelings. And that's really challenging because it's easy to have our armor up and not allow that to penetrate us. Drugs use seen as a barrier to being believed. I think if my voice had been heard sooner and the people like teachers and medical staff that came and interacted with me took the initiative to look beyond what they thought was happening, I don't think I would have stayed in the life so far. Because I remember that one hospital visit, I had told them there was something seriously wrong with me. My chest was out to here. I did not deny the fact that their physicians were going to find drugs in my system, but I was like, seriously, something's wrong. The nurse that dealt with me told me I was drug seeking and sent me home. And then after trafficking, it looks like this person had a more positive experience other than being denied medication for ADHD. Right now, the healthcare providers that I go to see are private practices. They're still the level of their community health centers. I go to neighborhood health now, but we see only female doctors and we see one provider, all of us girls, and she knows about the situation we're in. She's always good. And they take on the financial part of our healing, which we're lucky. So these are really important ways to think about, it's not just during a trafficking experience, it is somebody's experience meeting with a provider. Next slide, please. So red flags to look out for. I struggle with this because I don't want us to be honing in on anything specific. But what are the STIs, stomach problems, multiple pregnancies, signs of physical abuse, such as burns or bruises? There was one trafficker that I knew that would burn, his tail was burning women. And so I knew who was being trafficked by this man or by this group based on the burns on their body. A person may not be wanting to speak for themselves. There is likely going to be paranoia, anxiety, or nervousness. And again, we are asking them to be vulnerable and open with us and without knowing and understanding and trusting us. So please, let's give that grace because I know that I may be a rabid dog if somebody is trying to get into my personal space and I am not in a space to offer any of that to them. There may be inconsistencies in their stories, and that may be because they've been given a script, but that also may be because it's not clear to them because that it is not linear. Healing is not linear. Medical issues that haven't been treated in a timely manner, but I think also we probably see that regularly because nobody really likes to go to the doctors, right? We seem to let things compile, or somebody considered as a frequent flyer. Next slide, please. And so when we're talking about victims of trafficking, we have to understand that individuals that have experienced trafficking, they already are having a hard time trusting authority figures, including healthcare professionals. I think I had said this earlier. I had a client that was uncomfortable with going to the ER because they had a warrant and they were in fear that the hospital was going to call the police, right? And so while you're with somebody, just understand and accept that distrust should be accepted. Why should you be trusted? And I think when we're talking about do you care, do you pretend to care? I think a lot of us fake it. We have or not pretend, but we care. I think sometimes we have varying levels of how authentic that can be. I at least know that in my situation with some of my frequent flyers because I feel all of these same exact feelings. And so when we're talking about that pretending to care, being really mindful of if our body language or our voice is patronizing and is there a tone shift, right? And so we are just really paying attention that we are also being assessed. Can we be trusted? Why? Why should you be trusted? Because just because you have a badge or a name badge and you're a provider and you have HIPAA and confidentiality, that doesn't mean that we should be sharing all of our secrets. What are your interests and priorities? Where can you humanize yourself and share a little bit of yourself with the individual that you are working with? You have boundaries, right? We all have boundaries, but how can you show up a little more human, a little more giving of yourself? Because that is what's going to allow that person to feel safer with you and start your process of building rapport. Next slide, please. And so it's so important that we are, right, allowing that individual to redefine success, right? Using patience when trauma responses arise, right? Respect their decisions and self-determination, not pushing somebody to speak to us, not begging that, right? Recognize that the individual knows their risks associated with them seeking help better than you do. They know their situation better than you. Avoid damaging the relationship in order to get a decision. Saying, I'm not going to pry, but I want to know I see you, I hear you, and I thank you for sharing what your experience was. Recognize that everybody is on a journey. You are on a journey too, right? And that it is your role to create an open door. You are not or will not be everything for that individual. And allowing that person to redefine success. And success should not be based on getting a disclosure. We can know that somebody is being exploited, and what I want you to do or what I want us to do is to collaborate, to call somebody. How can we help this person? I see Sydney on here. Sydney's really good at collaborating. So it's important to stay consistent, right? And follow through on the tasks that you've agreed to, and that will then help to build trust in the support network. Next slide, please. And so managing our expectations. These are, we've talked about the diverse forms of trafficking and inconsistent definitions. And we can also talk about how a person is going to, their affect, right? And so it's so important in engaging with victims of trafficking that connecting them with a trusted and empathetic provider, and that finding that person who they can feel comfortable with to deliver that judgment-free care, and understanding all the characteristics and approaches to foster trust is key. And also doing that while we're probably not being yelled at, maybe, right? And understanding that that individual is going to have loyalty and affection for the trafficker. And we're not wanting to change that language. If somebody says, this is my boyfriend, that is their boyfriend. If somebody tells you they're a sex worker and you may feel otherwise or have information to tell you otherwise, they're a sex worker, because we're using their language. We're reflecting their language back to them until they are in a place where they can understand the psycho and receive some psychoeducation, and they're in a place to face what their experience has been, because we don't want to push that on somebody. So knowing and understanding that that person may be having some shame or embarrassment. They maybe have an easier time identifying friends or other victims because they're going to be afraid of being a snitch, even towards you, even your role, right? Because they're not wanting to break their family dynamic up. And they may likely change the subject, and that's okay because we don't want to push, right? We want to allow that individual to share their experience on their timeline. Next slide, please. So, what do? We keep it basic. Don't overthink it. Show up as yourself. Allow space for for talking without interruption, being okay with sitting in silence when you have the ability to do so. Listen to understand, not anticipating what is coming next. Provide them what they need in that moment, not what you think they need, right? Individuals who have experienced trafficking require consistent, long-term, and gradual process of building trust to feel safe in discussing their victimization. So just like the exploitation was a gradual expansion of boundaries, it is going to be gradual and take time for us to create the building blocks for us to build our relationship, right? And then allowing them to guide the conversation and let them tell you what they need versus telling them what's best for them. Next slide, please. What are some challenges that we're going to have? Feelings of frustration, knowing that they are rarely going to leave their trafficker despite their dire situations. Again, this is not on our timeline. And so just being supportive and knowing that that individual knows their experience the best, right? It may also be hard for you to understand trafficking. And so I'm going to be sending you some links and on you, and I want to help you through this process, but to absorb what you're like, stay current on knowing what's going on, right? It can be challenging asking uncomfortable questions or knowing when to ask those questions, right? There's no algorithm on, this is a needs assessment because it's so personal. The forced criminal activity, getting victims to create crimes, knowing that's a strategy used to keep them in control, but it can be really challenging when having to face court systems and navigate that with an individual. And the desire to rescue. There's no such thing as saving or rescue. We are not saving or rescuing. I don't believe in it. I believe in walking beside somebody and not pulling them along with me. I will not do the work for an individual that I'm working with, but I will show up. And sometimes showing up looks different depending on the needs of that individual. Next slide. I love this because it is so important that we are recognizing our own power and privilege, right? So power, we know, is the ability to influence and make decisions that impact others. And that privilege is the advantages and benefits that individuals receive because of social groups that they are perceived to be a part of. I know that I look and I present as a privileged white woman. I recognize that. I grew up in Southern Rhode Island. I am, I know that I am very privileged, and I name that with the individuals I'm working with. Next slide, please. And so when we're talking about that, right, when someone is trafficked, we want to know and understand that there is that inherent loss of power that occurs. And that loss of power, real or perceived, is a trigger. And we hold immense power. And so it's really important that we do not exert power and accept. You cannot exert power and expect to empower. And I feel that so strongly in my bones. Next slide, please. So putting it all into practice, what are we doing? We are creating connection, right? We are going to be work towards safety and belonging, offering non-judgmental services and knowing your bias and checking your bias. Sometimes I have to check my bias multiple times a day because the individuals that I'm working with, they know when I'm not completely present. Allowing the individual to have control of their own healing and give them space to redefine love, sex, and identity and create and model healthy relationships. Next slide, please. Oh, great. Cool. I mean, not so much time for I'll stick around for questions. But what I would love to do is, and take your time to think about this, but we didn't really get into what collaboration looks like because that would be, I need a whole hour to talk about how collaborations look. Who do you call? What would you do? And so maybe we can come back at another time and talk about, that deeper dive into how we can work as a team. And I'll share. I had the privilege of helping care for a friend of mine over the last 4 years who had ALS, and she died last Sunday. And in reflecting on that process with my friend group and applying that to my job, is that we need teams in our lives. And so we can be shifting from our robotic selves of being in a system and society that is asking us to do more, work harder, be more, and we need to start paring that down and really go back to that grassroots. How are we helping you? And come at it from a human approach versus a technical approach or a tactical approach in law enforcement. And it requires a team because I'm not asking you to spend all the time with the individuals that we're serving, but I'm asking you to allow me to help you in finding the people that have the time so that we can build the team so that the individuals that we're serving have the opportunity to live the lives that they're destined to have. Thank you.
Well, that was wonderful, and thank you so much for all the information, the resources, bringing it back to the humans. I feel like sometimes we can be a little bit detached from that, and I think bringing that back to each one of these individuals just really helps us all. We are exactly at time, but I absolutely recommend anyone sending questions, follow-ups. We can certainly find a way to connect everybody through email. And also, we really do appreciate any feedback that you all can share regarding today's talk with us. Um, and with that, I'm going to close things out and thank you again so much for this wonderful
Thank
talk.
you. Thank you.
Katie, you're amazing. You're a great speaker.
Hi. Oh, thank you.